I'm Dr. Lucky Seacon, a double board certified OBGYN and REI, and I want to give you 10 quick facts about Clomid. First, let's talk about how it's used. Clomid is used to help induce ovulation for people with irregular cycles, and it can be used for unexplained infertility to try to boost your odds by giving your body the opportunity or chance to release more than one egg. Let's talk about how it works. Clomid works by blocking estrogen receptors in your hypothalamus, which is a gland in your brain that controls your pituitary, and it fools your brain into thinking there is no estrogen. So it forces your pituitary gland to churn out more FSH and LH, which is what allows you to ovulate more regularly or even ovulate more than one egg. Here's how it's taken. Clomid is usually prescribed to be taken for 5 days out of each month or cycle, typically starting anywhere from day 2 to 5, and then taking it for 5 consecutive days in a row. A usual starting dose is about 50 milligrams per day, but you can titrate it upwards to 100 milligrams or even 150 milligrams per day. The typical monitoring during a Clomid cycle involves doing a mid-cycle ultrasound to see how someone has responded to the drug. Often we will do blood work at the beginning of the cycle to make sure that all the hormones are baseline before starting Clomid. In terms of effectiveness, if you're using Clomid to boost your natural ovulation and treat unexplained infertility, typically it's going to improve your per cycle chance of success by just a few percentage points. Common side effects of Clomid include hot flashes, mood swings, bloating, breast tenderness, and even nausea. Less rare complications include OHSS or hyperstimulation syndrome, as well as visual disturbances. A potential risk of taking Clomid is the chance of having multiple pregnancy or twins. The odds of multiple pregnancy is approximately anywhere from 3 to 8% per cycle. So it's not the most common outcome, but you are introducing that risk anytime you're ovulating more than one egg. Because we don't expect a huge jump in the per cycle success rate when using Clomid, this is one of those strategies where hopefully persistence will pay off. So typically when you're planning to use Clomid, you're going to do this for multiple cycles. And this might mean trying for up to 3 or 4 cycles and then moving on to IVF if it hasn't worked. But it could be reasonable to try for up to 6 cycles. Beyond 6 cycles, if you have unexplained infertility, the data shows that it's time to move on to IVF. The main contraindication or reason why one may not be able to safely take Clomid is having liver disease, obviously being pregnant or breastfeeding, having undiagnosed abnormal uterine bleeding, and ovarian cysts. If you want to learn more, talk to an REI about Clomid as a treatment option and make sure you're being supervised so that it's safe and effective.